All right, welcome to Sports Music and Other Ish. I'm your co-host Vic,
I'm your co-host Big John, aka the Black Jerry Maguire.
and today we have on Dr. LaChanda Dunlap-Wright. How you doing, Ms. Dunlap?
I'm wonderful, thank you. You don't have to say doctor. We know each other from school. It's fine, Vic. It's fine.
All right. Her specialty is obstetrics.
I'm an OB-GYN, obstetrics and gynecology.
Okay. Medical school is Philadelphia College of Osteopathic Medicine, the Georgia campus.
Mm-hmm.
Her residency is Mercy Hospital and Medical Center in Chicago, Illinois. Dr. LaChanda Dunlap-Wright is currently in group practice in Northwest Indiana, but continues to live on Chicago's South Side. Born and raised in the South, considers Texas her home state. When not at the hospital, she loves spending time with her husband and two teenage girls. When not in a pandemic, she enjoys traveling, eating food, sleeping, coffee, great TV shows, and having a great time. She is passionate about healthcare disparities in maternal morbidity and mortality rates in the United States of America. And in her bio, she capitalized sleeping. What was that about?
Because I like to sleep. I don't get a lot of sleep. As you know, babies come whenever, so I don't sleep well.
Yeah.
How's the family during this whole COVID-19 pandemic?
So, as you know, Mike, he works from home, so wasn't a big transition for him. For the girls, it was pretty rough. They have a social life. For me, it was different. I still had to go into the hospital. There was times where I think we spoke about this. I know we spoke about this. Not having enough PPE and different things like that. So, of course, things have gotten better. There's more testing, but it is what it is, unfortunately.
How difficult is it when you're delivering babies and having to come home with the children? Are you having to quarantine yourself away from the kids and then going back to the hospital?
So in the beginning, what we were doing, we lived in a different condo here. I was basically running straight home, like bypassing everyone, taking clothes off, jumping in the shower immediately, things like that. At first, they were like labor and delivery patients, not saying they weren't important, but we weren't like testing them to see if they had COVID. Then the study came out in New York, and that's when we start wearing the N95s and doing the full gowning and dressing up. And so it's gotten better. Now, with the mask mandate for the Midwest, most of all our states are mandated to wear masks. Is Texas doing that yet? No. Okay, moving on. It's getting better. So I came straight up here to my office and then I'll go shower later. But it's okay. It's okay. We'll get through it.
Are y'all more coronavirus positives in babies?
So not in our area. There was a big study that just came out in the Houston area. Some hospital had a lot of brand new newborns over the span of like 3 or 4 weeks that had tested positive for COVID and had COVID-like symptoms. Not in this area. We have not. There have been children that have tested positive, and there have been newborns, but mainly they're contracting it from their mother. The studies that we're looking at now is COVID virus able to basically cross and get into the amniotic sac and the fluids. And right now, I have not seen a new study that says it. There are studies that are going on, constantly changing with it. So hopefully we'll know more. Just like when Zika came out, do y'all remember the Zika virus? Mm-hmm. When the whole country of Brazil, they were having babies with microcephaly and then filing people in Florida, Texas, and we were able to do studies and show that it also was not only from those areas, but through the mosquitoes, and it was in the husband's sperm after he contracted it for 8 to 12 months. So it's an ongoing process.
What kind of modifications have you guys made to just some of your processes and how you handle these babies when they come out and, when you know this stuff?
So we push for a lot of things that are like baby friendly, like skin to skin contact, immediate breastfeeding, delayed bathing. Bathing are things that were really big for as far as maternal bonding. In the beginning, I'm not sure what my new practice is doing because I haven't delivered there yet, and maybe I should have read the delivery pamphlet, but I haven't. But what we were doing, where we were not allowing like skin to skin, we were immediately taking the baby over, doing a quick bath, making the mom deliver in a mask. I've never pushed out a baby with a mask on, but just running with the mask on is exhausting. And all the OBs in full attire, we always wear full attire, but adding the N95, it was just a lot different. Having NICU there, moms that had fevers, we were just more cautious. So I think we were taking the babies from the parents, from the mom a little earlier and doing quick bathing. But hopefully we get back to the bonding, the skin to skin, the immediate breastfeeding.
Yeah.
The one thing that I've noticed, and I'm kind of switching gears here from COVID-19 because I don't want to get that with the same, but my sisters are nurses, and I always see them post about the mortality rate when it comes to Black women having in America, and I've seen you post about it too. And I guess it's from my own lack of understanding. I just never knew about it and didn't understand, like, how can we have that disparity between Black women in America and white people in America, white women in America? Like, how does that happen? And can you that in general?
So unfortunately, we talk about things over and over, like health disparities. We talk about the increased mortality and morbidity in African American and brown women and women of color. We talk about labor deserts, maternity deserts. Like, for example, another hospital, the hospital that I trained at, just announced last week that they were closing. So that's going to be a lot of patients that don't have access to care. So if you don't have access to prenatal care, you don't have access to delivery, you don't get the same, you're not going to get the same treatment as someone who has the insurance and the reliable coming in to the doctor. And it's just a lot of gaps that need to be filled. There's no one like answer. So I always take it back to health literacy. If no one ever tells you that you had high blood pressure with your first baby and you need to be monitored better with your second, you're not going to do anything differently. If no one tells you that being obese can cause you to have preterm labor, it can cause you to increase risk of stillbirth, it can cause all of these things, it can cause your child to be obese, when no one ever tells you that information, you go into your labor situation with all these cards stacked against you. And implicit bias in medicine is very, very real. People do not, and it's not on purpose, it's just you do a study and I can be screaming in pain and a Caucasian woman could be screaming in pain. She's probably going to get pain medicine before me. I didn't know that I was discriminated against. With both of my daughters, when I had my babies, I thought you had to be 4 and 5 centimeters to get an epidural. I thought that was the rule. That's what they told me. They told me I really wasn't in pain. I didn't know what pain was. Like, you don't talk to people like that. And so when you get to a point where you're afraid to express, well, my chest hurts. You probably have a PE because you're afraid to tell them, because the last time you told them you were in pain, they told you, oh, that's nothing. So it's a horrible cycle that our healthcare system has got in, not taking women of color's issues seriously if they don't speak English, not doing that second step of getting a real translator. And what I mean by a real translator, not relying on a family member to relay what you need to say, by getting a hospital certified translator to do that, ignoring people's customs, making it seem like because they want to do a lotus birth, which I keep the placenta attached to the baby, to each his own. You give them the risk and benefits, but you don't shoo them off as crazy. Yeah. Or, a lot of women have decided, because the healthcare system is killing us, they don't even want to deliver in the hospital anymore. And they're going to women that may not be certified to deliver at do home births, or they might not be good candidates. So for a home birth, and then they end up coming to the hospital with me, and I'm like, so what's going on? And they're being just dropped off. And it's sad, because if I had all these things and these people were being so mean to me and not listening to me, I wouldn't come to the hospital either. I wouldn't deliver there either. You're not going to give me pain medicine. You don't tell me what's really going on. You want to give me the short version when you treat me like I don't understand things. You don't take the time to get to understand me, and I see someone else being treated a lot differently. It's a long road. Fortunately for OB-GYN, I'm under the ACOG, American College of Obstetrics and Gynecology. For the last several years, the push has been to decrease health disparities, to focus on racial biases. Physicians need implicit in culture training, nurses, we all need it. And just listening to patients, listening. But that's a little bit.
So sitting here listening to that and being totally surprised at, what's going on, that's not just a Midwestern thing, or that's like everywhere, correct?
That's everywhere. It's everywhere. It's absolutely everywhere. If you go to an area and all your doctors, you live, let's say I'll use San Marcos or anywhere, you look at the demographics, you got Hispanic, you got Black people, and you have a small percentage of white people. And if you go to the hospital and all you see is white physicians, we're not targeting the community. The community has Spanish speaking people. The community has Black people. We have to have places where physicians in places that look like us, not just because we want to go to a Black doctor, but maybe that patient might feel more comfortable, and that patient may be able to tell that doctor more things and express themselves a little bit better.
Yeah, because right now with my baby being in the NIC unit, we had a situation to where there's one doctor who doesn't talk to me at all. Like, because there's a rotation of doctors that come through, but my baby's main doctor, she always makes sure she comes talk to me and tell me. This doctor literally will walk by me and don't say nothing, but she'll talk to my girl though. But she will not. She don't say even hi. She don't even say hi. And I remember one time, well, just recently, my girl was telling her, hey, they told me that I could breastfeed sometimes, and sometimes you can do the bottle in here. And she pretty much made her, like, because the baby, I guess he was full and he wasn't eating, or he's been struggling eating now. So she made her feel like it was her fault, because she was like, when you get home, you can breastfeed anytime you want to. And, right now is not the time to be. Like, she just, like, her tone and everything was just all wrong. And my fiance, she called me crying. I was like, oh, what's wrong with you? She's like, it's my fault that the baby's not eating because the doctor, she's already thinking all this is her fault anyway. But the doctor made her feel like that. And so then her doctor, actually, the baby's main doctor, actually came in and just made her feel a lot better, because she was more informative about the situation. There's a way to like you said, there's a way to tell people things, and then that was just absolutely the wrong way, because now she's feeling that way, and now when she holds the baby feels it. You know what I mean? It's just a trickle down effect. But the question I wanted to ask you is, how do we get better informed? Like, I'm a fixer. I like to fix things, but so I know it takes a little bit. But from where you're sitting at, what do you see that we could change the most? Like, what's our first step?
So I think that people need to remember that physicians and nurses are people, one, and there's no person that can't be questioned. And I feel like a lot of patients, and the way society has been, is like, oh, you're a doctor, they don't really question things. And then you have internet doctors, and they don't want you to question them either. So Ask the questions when you feel like someone has done something wrong towards you. And I feel like this with all people of color. We need to say, hey, I noticed that, you walked past me several times. I'm interested in the plan of care for my child. Can you please tell me that? And if you can't or won't tell me that, point me in the direction of your chair, your supervisor, because I promise you, people that don't look like us do it all the time. They just demand change. They demand better. And in the beginning, it'll be like, oh, he's so pushy or he's so that. But you have to speak up. I actually live with someone who I honestly believe he don't like doctors. Like, absolutely, he thinks they're all dumb. And I keep wondering why. I don't know. But he asks a lot of questions, and it's annoying, but he's married to a doctor. He asks, well, why am I taking that for? What's the mechanism of action for that? Why do I need to do that? What is this for? I don't need that. If you're going to run this test, what is this test for? Ask those questions. We went to school for a very long time. We stayed up for a very long time. You pay a copay, you pay insurance, you demand our time that we're with you. But it's the practice of medicine. We don't know everything. We're going off of evidence-based. That's what we do. The evidence tells us if we do A, B, C, this is the likely outcome. That's how it's the practice of medicine. I don't know everything. That doctor doesn't know everything. Sometimes we're rude, very, very rude people. And sometimes we're very, very narcissistic and can be complete assholes. But that's people. People are like that. So in order to get change, we have to demand change. The hospital that's closing here on the South Side, hopefully they put together a petition and a protest. We need to demand for that hospital to possibly stay open. And if not, we need to demand somewhere for these patients to go. And every time someone goes to the doctor, just demand to know the plan of action. We all have to have a plan and an assessment and plan is going in our doctor's notes. So just demand that you know everything they know. So I think education, communication, I like when we were offline, what you were saying, break it down, make them speak slower. On another note, health literacy is the ability for people to understand medical information. If you Google health literacy in America, it's a low percentage of adults understand exactly what their doctor is saying to them. And it doesn't matter your race, creed, color, or education level. But because people let us sit there and go, your glucose is 5.1, you need to take metformin twice a day. No, metformin, BID, PO, come back 2 weeks, follow up, get labs. Okay, what is metformin? Where did you get this glucose from? What is the hemoglobin A1C? Why does it matter? Why am I taking it? What are the side effects? How much does it cost? Is there something else I can do? Is there nutrition? Is this? Nobody asks questions. I tell my patients, now ask me the questions. I might not like all of them. I might even get annoyed, but ask the questions. And demand change. Demand it. It's on the dockets at every state, morbidity and mortality. Look for it. Make sure Texas is talking about it. Indiana is talking about it. Illinois is talking about it. Georgia, Mississippi, the South has the worst morbidity and mortality because we have the worst healthcare issues, the obesity, the lack of access, the rural areas. So ask questions.
Will you talk about the importance of having a primary care physician?
Absolutely. Get one. See one. Know one. The ER is not your primary care physician. There's our age. I'm a lot younger than you guys. I know on paper it says 38, but I tell everyone I just turned 32. So I'm a lot younger than you all. But you guys are dagging your 50. So you should have seen your primary care doctor. Black men African Americans should be getting a colonoscopy by the age of 45. You don't know all of those things unless you see a primary care physician. You're getting your cholesterol. We die of heart disease. If you don't know how high your cholesterol is, if you don't know you have hypertension, you can't fix those situations. Diet change. I am not good personally at changing my diet, but the things you eat, all the things that you eat can change the trajectory. No, Vic, I am not about to get online with this Dr. Sebi stuff, but the foods you eat can change the trajectory of your health. But you need a primary care physician. You need a prostate exam. You need a speculum exam for your vaginal health. I mean, there's so many things that go into like the primary care physician, a family practice doctor, an OB-GYN, internal medicine doctor. There's so much that we do that we can help you and do preventative medicine that you don't end up in situations that we could possibly prevent.
I remember somebody on this podcast was laughing at me when we were working at Walmart. I was a doctor, you know, I had that insurance, so I was up in that thing. He was like, "Man, you go to the doctor every day." I was like, "I'm trying to see what if anything going on with it."
No. You don't know until you go.
Yeah.
John would get a sniffle and be at the doctor. He'd come back and get another sniffle, and he just left the doctor. They told him it was sinus. John go right back. John would go to the doctor in 7 days. He'd be there 5 days.
You know what though? You know what happened from that though? You know what happened from that? They ended up figuring out what my allergy was. I had to get a steroid shot, and I never had to go back after that. See, that's what I'm saying, man. It worked. It worked.
I believe it worked. I do too.
When you were saying about having birth, and women going and trying to do the alternative things, I've been seeing a lot of that kind of coming up more into the light of kind of having babies at home. 2-part question. So if a lady cannot afford Lamaze classes, are there anything out there to help her? Any kind of programs to help them? And number 2, I've been seeing ladies having birth sitting up instead of laying down. Is that the correct way?
There is no. Okay, so question number 1, Lamaze classes, YouTube meditation videos is about breathing. So most of my patients were not able to afford Lamaze classes. So there's YouTube videos that teach you how to breathe and do pain management. So if you would like to go natural, you can. Number 2, there is no correct way to deliver a baby. If you want to stand up, it's not my ideal situation. If you want to lay flat, if you want to lay on your side, if you want to squat, if you want to sit up, whatever is going to take the edge off for you to be able to deliver. Most likely you see women deliver on their backs because but not flat on their back, like in the reclining position because they have like some type of pain management going on or they need coaching. I've delivered a lot of ways, some splashes in my face, things I'm ashamed of, but however we got to get that baby out, we'll get it out. But a lot of women are delivering at home. I just advise all those women to make sure that they're being delivered by a certified midwife, a midwife that is certified by their state, someone who's had the proper training, and someone who's actually delivered before, if they can, and just make sure they do their research on their midwives. And I think I work with midwives in residency and I work with midwives now, and they are a joy to work with. They know a lot. You want to go natural, they can get you there, and they know how to manage patients very, very well. And I'm friends with a few of them. People just always have to do their research. Just do your research on everyone, doctors included.
With the shift of the births at home and everything, do you think it's just the lack of people not trusting the doctors, or is it more so, okay, this is how I want to do it, let me do it like this, you know?
I think it's a twofold thing. I think, yes, this is how I want to do it. I know a few nurses that have delivered at home, and they have wonderful midwives, and that's how they always wanted to do it. But then we have patients that have been wronged by the healthcare system, and they don't trust doctors anymore, and they'll go to midwives, and they'll be managed by them. I just think that whatever your choice is your choice. You have to make that choice. For me personally, I don't do pain well, so I'm in the hospital with the epidural.
Yeah. So this is my last question. Can you kind of tell us the importance of when a woman is pregnant? Because I floated that fine line of a lot of try to restrict my fiance from doing a lot, right? Mm-hmm. Trying to, because I knew she was struggling doing it. So can you help us men out, like, with that whole situation? Like, what, like, do you just do as much as your body can take, or
So let's say we had a young lady that came in and she was doing CrossFit before. Mm-hmm. Very vigorous exercising. She's always done CrossFit. It's not something she picked up 3 months ago and then she got pregnant. She's been doing it for years, 3 and 4 years. She's been running 5-6 miles. You continue until your body doesn't allow you to. So she can continue. I'm not going to tell her, oh God, you can't do CrossFit anymore, because that's what was keeping her happy and keeping her together. You don't go pick up CrossFit when you become pregnant. Exercising in pregnancy is actually pretty healthy. We want you to get 75 minutes of exercise per week during pregnancy. What we don't want you to do is decide this is the time you want to lose 20 pounds and all of a sudden you want to get in a new spin class in Peloton. No, you need to go walk in, you get in a pool, you do things that a person who ain't never worked out before, do.
Right.
Women, I think it's very hard to say, well, what should the men do? Every relationship is different. I meet men that are partners that don't do anything. She's still taking care of 5 kids, cooking all the dinners, hauling all the laundry, repaving the sidewalk. And then I meet men that she can't get up out of the chair without his hand pushing her butt cheeks up. Every relationship is different. So her body will tell her what she can and can't do. And if her body doesn't tell her, the baby will.
Yeah, I think I was the dude pushing her butt cheeks up out the chair, because I was like, yo, whoa, hold on, what you doing? You can't do that.
Yeah. So don't be controlling, because that's crazy.
And I'm not trying to be controlling. I'm just being considerate. I didn't think it was controlling. I thought it was considerate because I tried to pick up as much slack as I could.
He asks a lot of questions. Be on the lookout.
You have not changed one bit.
I am. I'm very quiet now.
No, you're not.
Whatever.
But the last thing, can you, what would you say to a young men, young women who look to go into the medical field, as someone that I've seen, that me and John both seen on the undergrad level, knew you, your husband, our DP, of course, and been knowing you for a while, and to see you at this point, what would you say to young men and young women that want to look into going into this field?
If you don't grind, you won't shine. It's all about the grind. Like, it's a grind. It is not for the faint of heart. For women and men of color, it is a lot harder. You have to work hard. Nothing will be given to you. You guys know we were living in Texas. I was working in a corporate job. I came home and literally told Mike we're moving to Georgia. And I did a post-bac program for 1 year, got in, and then I was always studying, and then came back home again and said, now we're moving to Chicago. And I had a great support system. I actually, no matter what anybody says about Michael Wright, he's okay. He's a good dude. He's a great support system. Because most people won't be able to say that. Like, I had 2 kids as well. But you have to grind. And there are so many people that want to be physicians. And when you are the only Black face on a rotation or in a hospital, you're being watched. You have to work hard. And it's going to be hard. It's so doable. I want more people to go in. Every kid I see, anything else but a physician, we actually need you. But they have to work really hard. And you don't have to have the best grades. You don't have to have the best test scores, but you have to have that grit, which is also a book that everyone should read. You have to grind. Like it's very serious. And I just got home. I still have notes to do. They just text me what's for dinner. It's never ending. I think he's gonna order dinner. Let's all say thank God that Mike ordered dinner. But it's a grind, a lot of studying and a lot of money. So vote for no debt for medical workers. It's a lot of money.
Hey, once again, we thank you. We appreciate you.
Oh, wow. It's over. That's good. Oh, thank God.
Appreciate you giving the information out to the people. John, you got anything last things, John?
No, that's it, man. We really appreciate you.
Okay, thank you so much for having me. This was actually pretty fun. Maybe we can do something over sexual dysfunction later.
And
no?
Sounds great. Whatever.